Good afternoon, everyone. It's my proud privilege to be talking about my 750 cases of MND. Why I chose MND as my research paper was, it's an interesting story.
MND? What's MND?
Motor neuron disease. That's called, ALS, commonly used as term is ALS in America, but in this part of world, we use MND, motor neuron disease. And why I chose that, for my research book was an interesting story. I was called upon to see a patient in Assam. When I went there and saw the patient and came back and wanted to dispatch the medicine. And before I could dispatch, I was told that she's no more. So that was the one particular incident which has really shook me very badly, and I thought that something needs to be done about it, because this is one disease where allopathic people say there is no treatment, no cure, and nothing is possible to be done in that cases. So for homeopaths, it is a very big challenge that if we could do something on this. And at AKGsOVIHAMS, we have found some very encouraging results to help those patients suffering from motor neuron disease. Now, as you all know, Stephen Hawking was the everlasting longest life with suffering from motor neuron disease. Despite of being completely handicapped and in that solitary affair, he could manage himself the long life and active life, because he himself was a scientist and he never took that particular thing which the neurologist told him that nothing can be done about it. It is an uncommon degenerative disorder of motor neurons, leads to progressively paralysis of cranial and skeletal muscles. Onset is insidious. First symptoms may be a stumbling, weakness in grip, hoarseness of voice, cramp of muscles, or muscle wasting. Condition is called incurable and leads to death within a few years of diagnosis, generally 1 to 5 years. And the disease came to the notice worldwide when the celebrated scientist Mr. Stephen Hawking was diagnosed with ALS, the most common form of MND. As I told you that, this was the reason that we started doing some study on that after the case. Some very encouraging results were obtained with homeopathy, which motivated us to conduct this observational prospective research study on to evaluate the efficacy of homeopathy and treatment and management of MND. No treatment and hope is a challenge for homeopathy, the one which we took on our stride. As it is a fast, progressive, degenerative, devastating illness which leads to progressive paralysis and eventual death. It is considered to be an incurable disease where modern medicine people or modern science does not have much to offer. No treatment or hope left for patients, usually told by neurologists and hospitals, make the patient and patient's family absolutely miserable and hopeless, and they start counting the days from that very day when they have been told that their patient has been diagnosed with ALS. When a doctor, usually considered only second to God, gives such a statement, it completely breaks the morale of the patient and the family members. Such statement on the part of the doctor can initiate a vicious cycle of shock, anxiety, despair, hopelessness, depression with the patient and his family members, starting down the fast approaching and unacceptable death. By the time the patient and his family members consult another professional or alternative system of medicine doctor for a second opinion, the doctor's words, there is no treatment or no hope, that haunts the patient and the family members have almost hijacked the patient's belief system and caused significant damage, which becomes a major hurdle in responding to any form of subsequent treatment and recovery. And encouraging results we found in homeopathy. Now the aims and objectives to study the effect of homeopathic treatment on the progression of the disease, and this enhances the span of lifespan of the patient, to see the efficacy of homeopathic treatment on the improvement of quality of life of the patient and to bring about the symptomatic improvement. All the cases which we took were pre-diagnosed cases with the help of MRI, EMG, NCVs, etc. and by the neurologists of the reputed hospitals. Our observations: out of 70-50 cases were registered initially. Of these, 660 cases followed properly to the eligible for this observational study. Female patients were 410 and male were 450. Following set of symptoms were observed in the most of the patients. Fasciculations were there in 590 patients, slurred speech in 560 patients, generalized weakness in 560 patients, and this is a few videos that we are not going to play because of the paucity of time, where we could see the fasciculation, speech and generalized weakness after taking the homeopathic treatment has improved and to a greater extent. This is a short, each case has got a video. I'm not going to play, I'll just play one complete case because these are only the symptomatic things that's showing that how many patients of that particular problem has been improved with homeopathy. Like in this case, his fasciculation improved and speech improved. This case, the curare was a medicine which was given. This was a patient from Bangladesh with a causticum was the medicine given. Now, difficulty in following was noted in 430 patients. Choking was noted but in 360 patients. Again, the video of few, these are the few patients, those who have improved symptomatically. See, this is another one particular problem in this particular disease, that you have a different type of symptomatology or coming up symptoms coming at different timings. Patient may come up with a bulbar onset in the beginning, and gradually there are other symptoms which start getting like in the limbs and spasticity or fasciculation, or there are patients, as I told in the beginning, may come up with few initial symptoms, could be any, but the classical case may have all the symptoms, which could be having upper motor neuron as well as lower motor neuron as well as bulbar palsy symptoms too. Fasciculations were noted in 300 patients, and salivation was again 300 patients. Coughing was seen in 230 patients. Symptoms of tongue. Now this is another very interesting part, because the tongue which the patients show, initially they may have completely retracted tongue, and they are not able to speak, there is absolutely no speech in them, or there are people who have got a slurred speech, there are people who would come with a nasal voice, and gradually the speech also gets completely lost. Difficulty in holding the neck, and there were 200. Now this was a case which had made me go and work for this. If you can see this particular patient, the headgear was tied with the back of chair to keep the neck holding to feed the lady. Otherwise it used to fall, and she could not open her mouth. She was being fed by, a cotton dipped into the vegetables and this kind of thing. When I saw her, and this was a patient when I came back and was about to dispatch the vaccine, and I was told that she's no more. So without starting the homeopathic treatment, she's already gone. So that was really a big shock for me. Tendency to fall we had in 330 patients. Now these were the patients who were showing in a different symptoms with the breathlessness and all that. I've given few remedies also with that particular patient which has made improvement. Salivation was there for 300 patients, coughing for 230 patients, tongue symptoms were there. Like you have patients symptoms with the fasciculation of the tongue would tremble, tongue would shrivel, tongue would become thicker, tongue would become thin. So these all are the symptoms which may show differently in different cases. And homeopathically, we are able to use them as a symptom, as a rubric, and we are able to get good medication. The only part, what I would say, in our counterpart, or what is the modern medicine people, what they have is only one medicine called Riluzole or Rilutor. That is one medicine which is being given to one and all the patients. Whereas in homeopathy, we do not have got any single remedy or single medicine to treat all the patients. We go on the basis of individualization, which has been our USP from given by Dr. Hahnemann, and that is why we are being able to get good results rather than allopathic part. Difficulty in fine movements, that you can't open up the button, or you can't tie up this thing, problem of your neck and all that. In 5 months, 160 patients were there. Overall, patients and the family members feel the homeopathy has helped them a great deal, not only in arresting the further progression of degeneration, but also has good improvement in various symptoms and quality of life. The conclusion. Now, this is a chart where you can see the efficacy of homeopathic medicine in different presentation of the patient. 46%, 50%, 57%, 85%, 60%. These have been the improvement in different symptomatology. Slurred speech, weakness, choking, falling, coughing, they all have shown improvement, but not every symptom has got a same degree of improvement. Now, here I come with a case. This was a case of a young patient who was 18-year-old, diagnosed with MND motor neuron disease with night emission. Present weight was 58 kilograms. The patient came to me on 26th of December 2019. This was a condition when the patient was to be picked up by somebody. This is his father, who used to carry him to the clinic or to anywhere wherever they have to go. He was to be carried in his arms. Complaint started from lower extremity with wasting of muscles and weakness, and 18 months ago. History of fever with urine infection, followed with weakness in extremity around 1.5 years. History of fall and back around 1.5 years. Complaint started after the fall. Unable to walk and stand on his own, has to be carried in lap. Fasciculation, twitching of muscles, wasting of muscles with emaciation and weakness. Generalized weakness in body, stiffness of neck, sometimes urine is of mud color and offensive. Semen emission with urine, spermatoria. Lost weight about 7 kgs. Gestational history, premature baby, 7 months, and history of no vaccination at all was done, and ailments from fall of injury or on the back around 1.5 years ago. This you can see, I hope you can see the wasting on this in the hand. Inability to get up. You could see the weakness of this particular patient, that he cannot get up from the chair. And in the effort to get up, you could see the wastage of muscles very clearly. There was a history of masturbation, night emission with excessive weakness in body after masturbation and night emission. Sleep disturbed by slightest noise, dreams, sexual and lascivious dreams, sudden gain of height in 2016. Papular rash with burning, better by uncovering or removing clothes. Mental general, very social and friendly, but now gets very easily irritated, wants to be in company of friends, feels happy when people come to see him, weeping tendency, emotional, anxiety about his health, and likes traveling. In investigation, the vitamin D was low, which was 15.5, vitamin B12 was more, which was more than 2000, and calcium was 9.4, magnesium was 0.96, and his ANA was positive and HC was positive too. This is the report on 8th of June 2019. EMG suggestive of neurogenic disorder, MND. His CPK level was 73. The remedy given to him was arnica 10 3 doses, half hourly, and followed by acid phos 30 TDS. The follow-up on 17th of February, slight difficulty in swallowing, weakness, present tingling in hands, twisting of muscles, stiffness of neck, sleep improves, headaches in temporal region, better by closing eyes, crackling in joints present, back pain, worse lying cramps, and investigation ANA become negative, has improved, calcium was the same, CPK also came down, which was 70.5. His vitamin D improved from 15 to 33.2, and urine examination showed crystal of calcium ovulates, and CBC showed lymphocyte 30%, monocyte 01. Acid phos 1M, 3 doses, 15 minutes, followed by Met 30 TDS. In June 2020, the patient came to my clinic with his help of his brother. Walking improved a bit, now able to walk 3 to 6 steps with support, night emissions 2 to 3 times in week with weakness, vertigo with darkness before eyes while sitting, fasciculation, weakness in hands with loss of strength, weakness generalized. Now he can walk with the support. Now in October 2020, and this was the time when the COVID had started, we could see the patient was coming with that mask also. Able to stand up now with minimum support from other person. Slight improvement in trembling, while seminal night emissions improved once in 10 to 15 days. Now can walk 40 to 50 steps. Weakness improved, circulation improved, almost stopped, occasional in arms and legs. Now, if you remember the type when he came to me in 2019-26, he was unable to get up despite of his trying his best. Now at least he could get up after making a step with it, difficulty though. This is in December 2020. Emaciation restored, able to get up, needs lesser support in walking, and the balance is better. Stiffness in legs is better, fasciculation in back of thigh occasionally. Now see how struggling, after the struggle, he is able to get up, which he was able to get up from the chair. And this is in January 2013, that is after 13 months of the treatment, trembling in legs have improved, fasciculation almost negligible. Patient is now able to climb up and down the stairs in his home. This is in March 21, after 15 months, patient can get up much easily than what he used to do earlier, stand for some time on his own and gain weight. No song is
Previous one. Yes, from there.
because this was a young chap who wanted to, serve in the armed forces, and with the condition which he was in, that he was being carried away anywhere and everywhere by his parents or by his brother and father. Is it there now?
No, I'm sorry.
No, no.
No, the septics are correct. So the sound is not saved in the video.
No, it has been there.
So I'm going to interrupt you. Check one more.
In the last
45.
No, no, no.
There's still no live. Some other music. Here it's working. I have to interrupt you.
I think there was some glitch on the sound. Now you can see that he can stand on his own without much of a support, though he still requires the support. Well, then it was in the March when he could get up much easier, and in June you could see that much better in general and circulation almost gone and lesser, reduced trembling of the legs, able to get up on his own and walk without much of a support. This was in July 2021, had COVID vaccine on 4th of July 2021, and the weakness increased immediately after the vaccine, especially in legs. You could see the difference. In the previous slide, he could get up in a much easier manner than this one. This we need to listen. Soon after the vaccine, he developed so much of profuse perspiration and profuse weakness that he could not get up. And if you remember, I told you that he never had any history of vaccination as a child also. This was the first vaccine which he was introduced to him, and after the COVID vaccine, it has got an adverse impact on his system. But the patient is explaining that what has happened soon after the taking the vaccination, he got profuse perspiration, followed by extreme weakness in the legs that he could not walk. Almost he was about to fall. On 13th August, again, after the dose of Thuja, which was being given for the bad effects of vaccine, circulation, especially in legs, became better, and weakness much better, nightfall still present, but no further weight loss, and now he has gained weight. And now you could see that he is able to walk with a stick. December 2021. get up easily and walk also. I think this is in May 2022. See the comfort, he is able to get up. Back to the normal state. This is in September 2022. Fasciculation increased a bit because of natural cause. The musculature of hands go further emaciation. Now see that difference, the way he could walk. There is no more imbalance. In March 2023, there was a history of surgery for hernia, and this particular time,
शुरुआत में आया था, मैं बिल्कुल चल नहीं पा रहा था, यहाँ तक बैठ और भी नहीं पा रहा था, यहाँ तक चम्मच तक नहीं उठा पा रहा था, इतनी बड़ी दिक्कत थी, तो खा भी नहीं पा रहा था सर से, अब मैं चल फिर ले रहा हूँ और दौड़ भी ले रहा हूँ।
पहले जैसे मोबाइल उठा के लेके आना पड़ता था,
अब ऐसा कुछ नहीं है।
और अब अभी बीच में क्या क्या दिक्कत होती थी तब?
बीच में सर वीकनेस बहुत ज़्यादा पड़ जाती थी सर।
And the remedy I have used, it was acid force, stabilizer, naphthalmica, puja, lambam, china and kurare, and the auxiliary measures, physiotherapy, protein diet, meditation, exercises. And this was the state, proceed from 2029 was the state when he was brought on labs. On October 2023, we were and the best part is now he is preparing himself to join the army. Homeopathy has been able to slow down the stop and arrest the progressive degeneration further in most of the cases. Homeopathic treatment provided symptomatic relief in predominant complaints in many patients. Let's put our best efforts to put and help the cases of MND. And this particular month is being celebrated as a MND awareness month. And in our case, every day we are showcasing one case of MND on our website and www.OVIHAMS.com. So just to create the awareness, because the more important part is until people are being made aware, they've been losing complete faith as told by the allopathic doctors and this neurologists. So we need to create that kind of awareness that everything is not lost, though it is not an easy disease. But if you keep your mentally strong willpower, we can win over. Now, in this particular case, there is a complete reversal, which does not happen on each and every case. Though I must say, I must appreciate that and tell them this is not in each and every case, but yes, homeopathy has been able to give a very, very substantial good relief in making good quality of life, minimizing the progression of degeneration, stabilizing the, doing the stable life of symptoms, plus the associated complaints which have been there, they have been improved. And the most important part is, once the patient develops the faith in homeopathy and starts seeing the improvements, he becomes more positive. And one thing very important which I would like to share in my study, what I've seen in all these cases, these patients are very sensitive by nature, and there is almost a history for some kind of injustice in their life or what they've seen. So that helps homeopathic doctors to treat in a better manner.
Thank you, Dr. Gupta.
Yeah.
Very respected. Thank you. Very impressive. So the next speaker